Have you taken 1, 2, or multiple rounds of antibiotics for SIBO only to leave your gut feeling more wrecked than it did before you started and no evidence of benefit? Many suggest that taking antibiotics or herbals will resolve your SIBO and you need breath testing to confirm it. Does this make you cringe every time you hear it because you know it's wrong? A better way to know if your SIBO treatment is working can be summarized in 2 ways: knowing how your symptoms should be changing and not following the typical but incomplete protocols recommended. Frustration should be expected when listening to your doctor tell you need to take 1 or multiple rounds of antibiotics, but not tell you how to know if your treatment is working until you have completed it. Waiting until a treatment is concluded to know if it's working is like telling a pregnant mother that she needs to wait to deliver at 9 months to be able to confirm her pregnancy. It doesn't make sense. Let me show you how to know if your SIBO treatment is working. But before we get started, let me introduce myself. I'm Dr. Arland Hill, and I help first-time and recurrent SIBO sufferers restore their gut function by targeting all 3 phases of the condition to resolve symptoms in a timely manner. I know you're antsy for me to get into telling you how your symptoms should be changing, and I promise I will. But there is something else that could tell you your treatment is not going to work even before starting treatment. It all begins with looking at your treatment protocol or your treatment plan. And let me be clear, if your treatment plan consists of antibiotics only or herbal, botanical, antimicrobials only with or without a FODMAPs diet, your treatment is not going to work. It can't, because it's significantly incomplete. And the reasons it's not going to work and that it's incomplete are as follows here. So first is that these often include breath testing, and the breath testing is used to guide the treatment. Here's the problem with that, is that these tests have high rates of false positives and high rates of false negatives. This is also termed sensitivity and specificity, but ultimately what this says is that the information you're getting back on this test may not actually correlate to what's going on in the body. What good is it at that point? Another reason that these breath tests shouldn't be used to guide treatment is that they're often depended on to guide the direction of the treatment in opposition to using symptoms effectively and even the characteristics of SIBO. And those are just as valuable. Those symptoms and characteristics can give you just as much insight and direction as to where you should be going with the treatment, and maybe even more. The other reason that depending on testing is a problem is that it drags out the treatment process. You're wasting time moving to step 2 and step 3. We'll talk about those here shortly. And delaying that process opens the door for the onset of SIBO again, and for maybe a different way of saying this, for what is generally termed a relapse. So that's testing. Well, but that testing is not the only reason that this process is incomplete. If you're following a FODMAPs diet, that's incomplete as well. That can set you up for some inadequate outcomes that you're looking for. And here's the reason for that, is that this is putting more emphasis on what you're eating versus how you're eating. And I want to be clear as I share the rest of this around diet with you, that you have to eat within reason. You have to eat a clean diet. But how you eat is more important than what you eat. And I will give a specific example to this shortly. You have to activate your natural gut rhythm and motility. That normal rhythm and motility has beneficial aspects to it that we need to attempt to harness. And so it supports an inherent flushing mechanism. So moving the contents of the small intestine towards the large intestine so they're not going to be problematic. And you really want to use 3 meals a day to attempt to accomplish this. So again, it's more about how you're eating as opposed to what you're eating. Right now, the FODMAPs diet, especially in the context of SIBO, it's the cool fad diet. But keep in mind that it's an IBS diet. It's an irritable bowel syndrome diet. It's not a SIBO diet. And in fact, the data on this for SIBO, one, is very limited, and it's not good as to what is out there. So it doesn't have proven efficacy as a SIBO diet. Probably some of the reason that this works is because the IBS and SIBO overlap at a very high rate. 75% generally is a number you'll see around this. But if you want to understand why following this SIBO diet may not be the best direction for you, take a look at the card here on the screen right now. I dive deep onto this and give you reasons why you might want to put more emphasis on how you eat as opposed to what you eat. So think about the diet overall as more of a diet of inclusion versus exclusion. What do you need to be including into your diet versus always trying to take out of the diet? Let me give you one example on this, and this is going to ruffle some feathers and goes completely against what the narrative is out there. But dairy in its raw A2 form should be consumed. And in fact, we actually do have literature to support this. There is research that has been done on this. It was done in Russia, and what it showed is that when dairy was consumed as a part of the diet, the likelihood of onset of SIBO was significantly less compared to those who did not consume dairy. So we want to be mindful about what we always hear and really question how we're using that information and if it's right for us. The other thing is utilizing the antimicrobials. Antimicrobials, whether that's herbals or botanicals, however you prefer to say that, or antibiotics, these should be part of the plan. These should not be the plan. And too often, these are the plan. We don't need to get into these discrepancies about which antibiotic. Yes, antibiotics can serve a role. Generally, combinations of antibiotics are going to be better. But if that's where the thrust of the conversation is staying at, you're missing the mark on SIBO. There's a much bigger picture here that needs to be dealt with. And when you're going past 6 weeks on these types of protocols, again, whether it's antibiotics or botanicals, there needs to be a solid solid rationale or explanation for why that's the case. There needs to be some type of dose modification here. And if that's not taking place, well, you should inherently expect problems to arise as a part of that because you're affecting the commensal organisms, the beneficial organisms in the GI tract. So that leads us up to then answering the question, well, what does a complete plan actually look like? A complete plan should have 3 phases to it. And phase 1 was what we were just talking about, which is the antimicrobials. But too frequently, this is where everyone stops. This is only step 1. Step 2 is looking at our digestive secretions and motility. And this gets a lot of lip service, but it doesn't get the attention that it needs. It's often glossed over, but it needs to be a high level of importance just as much as the step 1 dealing with the antibiotics or antimicrobials does. We need to use, whether it's symptoms, whether it's testing in the form of stool testing or blood testing, these can all help us hone in which of these digestive secretions are not functioning at a high rate so we can directly support those and significantly drop the risk for a relapse. That's going to be directly focused on looking at the acid, the hydrochloric acid in the stomach, the bile that's released from the liver gallbladder complex, and the pancreatic enzymes. Once that is accomplished, then we need to be thinking about motility. How do we maintain motility? And also asking the question, is the issue with motility, has this been of a short duration? Is this a chronic problem? If this is a chronic problem, what is the expectation for a relapse for SIBO? What's causing that? What can we do about that? And that then becomes what the primary focus needs to be. If you're someone that is dealing with decreases in dopamine production, you've got a history of depression, which is oftentimes linked to that, these can all be little clues. I'm just giving you a particular example here. But these can be little clues that your gut motility is not going to be sufficient over the long term, and you're going to always battle with slower motility if you don't have adequate dopamine. And I'll also add serotonin into that conversation because that fits into that narrative around depression and low mood. But the point here is that has to become part of the treatment process, and not staying so myopic on only looking at dealing with the overgrowth. Deal with the dynamics that set up the dysfunction that led to the overgrowth. That's the mindset we need to have. But guys, this is only step 2. Remember, there's 3 steps here. Step 3 is going to be looking at nutrient restoration. This is a definable characteristic of SIBO, nutrient deficiencies. If it is a definable characteristic, just as much so as bloating, gas, distension, pain, alterations in bowel motility, then we need to address that with an equal level of attention. So we don't want to just look at this with the mindset that doesn't require our attention, because ultimately doing that is not having a complete plan of how you're addressing SIBO, which means that you're ultimately going to fail. So you have to have a complete plan that is tailored to you, it's nuanced to you, because once you have that in place, that is what is ultimately going to tell you if your SIBO treatment is working. Because remember, that's ultimately why we're asking these questions. That's why we're having the conversation today. We want to know, is your SIBO treatment working? And the probability is, if you're in some of these mindsets, or you're trapped into these models that I've shared with you up to this point, and they're hyper focusing on any one of these things and not giving you a complete plan, your SIBO treatment, it's not working. I'm just going to go ahead and tell you that it's not working. Okay. Now, coming off of this conversation here about these 3 steps, if this is the first time that you've heard of the 3 phases of SIBO treatment, well, you've got 2 options at this point. You can watch my other videos where I visit these different phases and I get into their importance and I talk about them at length. Or you can take a look at the program that I built that is specifically for you, which is known as the SIBO Solution. I have a link down in the description that you can follow through on. Now, it will walk you through all 3 phases in a clear and actionable way. Now, when I started this video, I promised you that I would walk you through the symptoms and that we were going to talk about these and how these should be changing as you go through over time. So once you have a solid plan to work from, then you can have a reasonable idea of how to use these symptoms to know if your treatment plan is working. But if you don't have a complete action plan in place, this is why I started with that, then the symptoms are going to be misleading. We want those symptoms to be accurate indicators for you, and an effectively set up treatment protocol does that. So when you have the initial, let's go back to our steps here. When you have the initial antimicrobial phase, these are in general going to be about 4 weeks. Some are shorter, some are longer. Oftentimes they get drug out longer, but 4 weeks is a good general average time frame for us to think through here. Okay, so that's what I'm going to use as we go through the rest of the information, knowing that it can vary. If you don't have a reduction of your symptoms in the first 2 weeks, things aren't working, guys. You should see some change in the first 2 weeks. And you need to have appropriate expectations with these changes. If you're going in with overzealous expectations, you're going to be set up you're setting yourself up for failure on this, okay? So don't expect complete resolution in this time frame, but here's what you want to focus on. You do want to focus on those gut symptoms because they are the primary symptoms: the bloating, the gas, the pain, the distension, the alterations in your motility. And honestly, of these, in my time as I work with patients, the alterations in the motility is the one of these that seems to want to change the slowest. It does change, but it changes the slowest, and it changes because we have a complete plan in place. But the gas, the bloating, the pain, the distension, those are going to be likely your first indicators. And what you're looking for here is not that these have been completely resolved, but did you notice a change in the severity? Did you notice a change in the frequency? As in, maybe you're having some times after meals now where the symptoms aren't showing up, or maybe the severity after those meals is less. Is the duration of those symptoms less? And if that's not happening, it's time to call an audible. It's time to look at doing something a little different. And that doesn't mean necessarily just go in and change the antimicrobial strategy. That means that some of the other facets around how you're eating, some of the things you're doing in your lifestyle, some of the things that could be influencing your motility, some of the foods that you should be including that maybe you're not. Maybe those are the audibles that need to be called to start pointing you in a different direction to get you towards a reduction in symptoms. So and here's something else. The worse you start out, like meaning that the worse your SIBO is starting out, you generally are going to expect to see a more noticeable change. Again, not resolution, but a more noticeable change. The less severe your starting point is, the less dramatic you're likely to see with your symptoms. Now, as it relates to these symptoms, I want to bring in what should be considered secondary symptoms, right? So these are not the ones that are directly the result of SIBO, but these are the ones that are happening secondary to the disruptions in the overall physiology related to SIBO. Okay, so these are going to include things like brain fog, fatigue, changes in your sleep, mood alterations. These are going to be related to other molecules in the body. So neurotransmitters, nutrients, hormones. These are not going to rebound as fast as the change in the symptoms that you would expect that are directly related to the SIBO. So again, the brain fog, the sleep alterations, the mood, these take longer generally to change because they're coming from a different rationale than the ones that are directly centered and oriented from SIBO. And these are, depending on what your level of deficiency in these is as the starting point, these could take months to resolve. If you've got, for example, a significant overt nutrient deficiency, well, it takes 6 months to get these nutrients built back up into your immune system cells, into the living cells in the body that are changing and that are dynamic. So give yourselves realistic and reasonable time frames to get these back up. But here's the great news around that is that it's not as if these symptoms are going to take up to that 6-month point to improve. You're going to start seeing an improvement in your symptoms prior to that time frame. So don't keep waiting and waiting and waiting for your symptoms to improve. That is the wrong strategy. If you're on the right track, your symptoms will begin to improve within a reasonable time frame. And again, if you're using that 4 weeks as the initial antimicrobial phase, halfway through that, we should start to see something. Well, now that you know, and now that we've talked about how to know if your SIBO treatment is actually working for you, let me show you how long it should take to treat SIBO and how to shorten it. Click on the link in the video or click on the video on the screen and check that out right now.